Move on for now. The Institute for Economic Justice has accused Finance Minister Enoch Godongwana of going rogue by delivering an anti-poor budget. It says he also didn't deliver on promises made by President Cyril Ramaphosa in his State of the Nation address. The president promised the social relief of distress grant as well other relief grants and would be protected from inflation. Yet the SRD remains unchanged at 350 Rand a month, despite the rising costs of living. The Institute says almost 3% less will be spent on service delivery and on programs benefiting the poor, while taxpayers, who are the wealthiest 20% of South Africans, will receive real benefits. Now, to discuss this further, I'm joined by Mr. Zimbali Mncube, who is a researcher at the Institute of Economic Justice. Good evening to you. Thank you very much for joining us here on eNCA. First and foremost, let's just chat to you about your concerns, or rather your organization's concerns about what was said in the budget, specifically when it comes to the impact on the poorest of the poor in South Africa.
Thanks for the opportunity. We are really disappointed in this particular budget tabled by the minister for particular three key reasons, some of which you've mentioned in your opening remarks. We see that overall, basically when you calculate that the amount that should be spent on service provisioning, if the expenditure allocated to this had been increasing in line with inflation, we would need to spend about 162 billion, right? And so that is currently what we are seeing in this budget. We are losing an amount of this magnitude, particularly when you look at healthcare. It receives it loses rather an amount about 50 billion. Basic education, if it was increasing in line with inflation, we would need to spend 39 billion, and in social protection would need to spend 37 billion. And so this is how far behind this budget is in keeping up with the needs of the people on the ground. Secondly, the tax relief measures that have been proposed in this budget accrue to the highest earning 20%, right? We see that the personal income taxes have been adjusted, and so the rich that can afford to pay for basic necessities are not asked to pay more on taxes. In addition to this, the amount that one can withdraw at retirement receives an upward inflation adjustment of 10%. Now, this amounts to basically redistributing money from the poorest 80% of the population to the richest 20%. And lastly, the point you mentioned on the SRD grant is really important, because the amount of need for this grant on the ground is not supported by the evidence that Treasury has presented to the table and the allocation that it receives. For instance, we asked the question in the Q&A session with the officials of the National Treasury, and they indicated that the reason that this grant is receiving an 8 billion cut is basically because the means testing, which targets who can get this grant, has been working efficiently. But when we speak to beneficiaries of this grant, you find that actually the new regulations that were proposed last year, which have since been adjusted, still become obstacles in terms of applying. And so that has led to a decline in the number of applicants, but it doesn't mean that people do not necessarily need the support on the ground. We know for a fact that about 13.8 million people live below the food poverty line. And so the support that is given to them is really not clear in this budget. But what we are seeing is that the richest 20% get the relief measures.
Mr. Mncube, let's just chat about the implication of these budget cuts, specifically in health and education. Health down by 4.9%, education down by 2.4%. To some people, this might sound like a lot of numbers, and they can't really grasp the direct impact of such a cut. Just talk us through how this impacts the poorest of the poor.
Yeah. So when we zoom in on healthcare in particular, what this means in real terms, it means that for every user of the public healthcare system, the government reduces the money it spends by about 400, from 5,000 rand per user to about 4,600 rands. That is between 2022 and 2023 in constant rands, right? And this basically has a direct impact on those that rely on public services to receive their healthcare needs, right? And when you look at basic education, like you said, it falls by 2%. What this means is that the amount that is spent on a learner decreases from about 22,552 in 2022-2023 to about 21,630. And this will affect real needs of the learners in terms of textbooks and what they need to basically receive quality education. And what is more worrying is that these cuts in these essential services, they come off at the back of increasingly unfilled vacant posts, both in education and in healthcare. And so they will, in the long term, result in the lack of development of human capital and skills that people can then use to participate in the economy.
Mr. Mncube, I'm so sorry. We have to wrap it up there. I've unfortunately run out of time. Really interesting conversation, but thank you very much for joining us here on South Africa Tonight. We appreciate your insights. That was Mr. Zimbali Mncube from the Institute for Economic Justice, just chatting to us about the impact that the budget will have on the poorest of the poor here in South Africa.